Hello, my name is Michael Gillard. Alright, so the syndrome that I chose was compartment syndrome. And so compartment syndrome is basically the buildup of pressure in a muscle compartment that causes ischemia, nerve damage, and possible muscle necrosis. And so some clinical manifestations of this would be some pain, some paresthesia, some pallor, some pulselessness, paralysis, and later on in the stage would be to be cool to the touch. So some other syndromes that would affect the muscular system, skeletal muscular system, like compartment syndrome, would be rhabdomyolysis. So rhabdomyolysis is basically the breakdown of muscle, causing a massive dump of myoglobin into the bloodstream, like lots of protein into the bloodstream, which causes like dark urine, and kidney damage. It's a little bit more systemic than compartment syndrome, which is a little bit more localized. So those are some of the differences you'd see with rhabdomyolysis. And then also myasthenia gravis. So basically that is a disorder in which the immune system attacks your acetylcholine receptors in the synapse between your neuron and your muscle. And so basically that would cause paralysis. You'll be able to use that muscle. And so the difference with that would be that with compartment syndrome, you see a lot of pressure and a lot of swelling. And you wouldn't necessarily see that with that myasthenia gravis. And then the last one would be acute limb ischemia. So that would be basically where acute arterial ischemia, so where emboli, a clot would form in the arterial, and which would cause ischemia, so the lack of blood flow, which would cause lots of pain. And then so the difference between that and compartment syndrome is that in the beginning you would see pulselessness a lot sooner than you would in compartment syndrome, while that would be a little bit slower of a progression of pulselessness that you would see in compartment syndrome. So that's a difference there. And then some diseases for compartment syndrome would be that could cause it. Compartment syndrome would be a fracture. So let's say your fracture, it would cause a lot of blood and swelling and fluid to accumulate in this area in the compartment, which would cause a lot of pressure and swelling. And then another would be a crush injury, which would cause like muscle damage, swelling, fluid lots of fluid in the area, inflammation. And last one would be reperfusion. So let's say like you had like your acute arterial ischemia, basically you had that clot there, and then you got rid of it, and then there's a massive reperfusion of fluid back into the area again. It could also cause some compartment syndrome. So, yep, have an absolutely amazing rest of your day.